In this presentation, I want to go through some of the things that you can look for and notice as you're looking at your horses to determine if they're healthy or if they might potentially be getting sick. Pretty much any good horseman should really take a look at their horses every time that they go through them. And the earlier that you notice some things, probably the better the outcome might be. So to me, it's very important first to do pretty much a basic overall health assessment, and some of this you can just pretty much notice on your horses about each and every time that you take a look at them. So some things that you should really look at would include just their general body condition score, any changes in their behavior. Over time you might notice differences of what their haircut looks like, their hoof, do they appear to be hydrated, have plenty of fluids within them. Kind of whenever you're out there with your horses, take a look at their eyes and their ears and make sure that they look bright and cheery, that there's nothing negative going on. As you are around those horses, make sure that you notice any changes in their manure, in their color of their urine or things like that. Mucous membranes, take a look in their lips and things like that. Their overall performance is a good idea to look about, and you can also know what their vital signs are. So if something seems to be maybe be not exactly quite right, then you can be able to notice things quite quickly. So first, to talk about a little bit of behavioral kinds of things. Most of the time you're going to pretty much know your horse and know what's normal for them, and some of these are more you'll notice more if they're out in a group or in their stall, but take note of a lot of different kinds of things. You know, are those horses that are normally together kind of start to isolate themselves away? Do they stand off away from the other group of horses? Are they cleaning up their feet? You know, do they not want to eat their grain as what they normally had, and some things like that. Changes in their general behavior. Are they more nervous or are they more lethargy? You know, do they act like something's bothering them, or the flip side, that they're very lethargic? Along with that is, you know, is there any change in their just overall activity level? Take a look at their eyes. You know, cloudy eyes, droopy eyelids, just like on a child, those can tell you quite a bit. And then also kind of just do an overall look to see, you know, do they have any swelling on their legs or face or any of those types of things. So anybody that has horses should really know what the horse's normal vital signs should be and really how to take them. If you think your horse is getting sick, you can take their vital signs as you're communicating to your veterinarian that you might have an issue going on. So it's a good idea to be able to do these kinds of things. So it's important to note that the normal resting temperature for an adult horse is right around 100 degrees Fahrenheit. Anytime it gets above 104, I would really say 103, 104, then there is some type of fever going on, and you really need to get in and investigate that and see what the infectious kind of thing might be happening. For horses, we use a rectal thermometer, as you can see here, where it's placed in the horse's rectum. And different things can affect the horse's temperature, such as, you know, hot weather, really humid weather, if they have a lot of exercise, and those things can elevate it, but that's generally going to only get up 101, maybe 102, right? Again, back with taking their temperature, you want to make sure that you stand to the side, lift the horse's tail up, lubricate that thermometer, and gently place it into their rectum and hold it in there for 60 seconds. Most of our digital thermometers will have a where you can push a button and they'll beep when it's reached the temperature. The next vital sign that I want to talk about is their heart rate, okay? And for a horse at rest, their heart rate should be 30 to 40 beats per minute. Now, you really only need to take this for 15 seconds, and then you can multiply that number by 4 and give you the horse's heart rate for a minute. So the different places that we can take this are underneath the horse's jaw, which can be a little bit difficult. You can also take it at their stethoscope or inside their pastern, okay? Or if you have a stethoscope, you can take it behind their elbow down kind of sternally. Probably the easiest one to get the read is if you have a stethoscope, to take it that way. It's still going to be a very deep kind of sound, but that's going to be a little bit more pronounced than either of the other two methods. Just like respiration and the other things, the heart rate can be really increased if you exercise them, if they're excited, or if they're having some significant degree of pain. Then it's also to understand that newborn foals, their resting heart rate is going to be a bit higher than what our normal adult horse is. The next vital sign to talk about is the respiration rate, which is really how fast they're breathing. All right, so when respiration for a normal adult resting horse should be right around 30 to 40 breaths in a minute. So if you divide that by 4 and take it, you can see that's only going to be a few breaths in that 15-second time frame that you need to take it, and then you would multiply that by 4. So we're really just watching and observing that horses breathe. So we can look in that horse's flank area and look for an inhale, exhale. You can also hold your hand over their nostril and watch them breathe as an inhale and exhale. So just like some of our others, the respiratory rate can be changed and will increase quite easily if they're excited, if they're being exercised in any way. Pain will increase it, a fever will. If it's very hot, the ventilation is very good, not very good. So a lot of those things can increase your horse's respiration rate. Something else to kind of observe with our horses, particularly you might do this if you think that they're not drinking very good or something might be going on, is to basically look at their mucous membranes. Okay, their mucous membranes when they're at rest, they should be relatively pink, kind of have a moist around the membranes. You can take your finger and press on them, which is called the capillary refill time, and press on those gums, and it really should be less than 2 seconds for a normal horse for those capillaries to refill. So if the mucous membranes are more red, bluish, kind of a blanche color, then that's an indication that something's not right. If that capillary refill time takes more than 2 seconds, that's also an indicator that things are not right. So a little bit related to their capillary refill time also might be if those horses are very well hydrated or dehydrated. So we can use that capillary refill time to look and as an indicator that maybe they're not drinking, maybe they've gotten a bit dehydrated. You can also take and pinch the skin on that horse's neck and see how it refills. So if it stays up and pinched, then that's an indicator that he's dehydrated. If it lays back down very quickly and normally, then that's an indicator that he's well hydrated. Something else that's really important to assess the overall health of our horses is their general body condition score. Most of the time these things change slowly over time. However, if horses are not drinking well or withheld from water, they can drop some body condition scores extremely rapidly. So remember, the body condition score is really an indicator of their overall fat on their overall body, and so we look at it at a variety of different locations, from along the horse's neck, down along the withers. Okay, we'll also look at the crease down their back. We look at the amount of fat cover they have at their tail head, the amount that they have over their ribs, and also behind the horse's shoulders. All right. The scale we use is on a scale of 1 to 9, with a horse being extremely thin versus a horse being extremely fat. So for horses, what we really prefer them to be is somewhere in an ideal condition score of that 5 to 6 range. So when we do this, we want to kind of look at the horses, and then also it's the best idea to go ahead and run your hands over them at all those different locations. It's also important to remember that in the wintertime with those heavy winter hair coats, it can make a false pretense as far as what those horses' condition score is because of their hair coat. So in the wintertime, it's especially important to put your hands over those horses because they could potentially be thinner than what they are. When you get into horses that are 6, 7s, and 8s, also palpating those different areas will give you a more accurate assessment of what their condition score actually is. So to give you a few images of what some of the different condition scores are, for the extremely thin horses, in the picture on here is probably a condition score of 1. They pretty much look like a bag of bones, with their neck, their shoulder, their ribs, easily to see their skeleton without ever putting the hands on them. There's really no fat accumulation of these horses at all. The 2s and 3s have a little bit more fat on them than this picture of this horse does. However, it's still very easy to see their overall the overall thinness of those horses. So when we body condition our horses on the very thin ones, the ones that are a 1 to a 3, these horses really pretty much are what I consider pretty much bag of bones look. It's very easy to see all of their bones of their skeleton for just standing there and looking at them, from their scapula, their ribs, their hips, down along their neck, and there really is no fat cover on them at all. Picture here is probably about a 1. 2s and 3s just going to have a slightly bit more fat over them and just not quite look like the walking skeleton that this horse does. 4s, you can still see their ribs. You don't even need to put a hand on them. Their backbone might stick up a little bit. The vertebrae and their scapula kind of stands out, but not near to the degree of what the previous condition scores were. When we move into a 5, these horses, their back is relatively flat. You can't see their ribs, but if you run a hand on them, they're easily felt, right? There's been some fat accumulation in their flanks and behind their withers and up over their ribs. So these horses would be a condition score of 5. Moving on to the 6s, as this horse is here, he might potentially have a little bit of a crease down his back. You put your hands over him and you can still press to still feel his ribs. You can feel a little bit more fat deposited behind his shoulders, up at his tail head in those different locations. We would really like most of our horses to be in this 5, 6, or 7 type of range. The flip side is if they start getting on the obese side of it. Okay, the 7s, 8s, and 9s are horses that are going to be extremely fat. This gray horse here probably is sitting somewhere around an 8, and there's more fat deposited. If you press your hands on these horses, particularly the 8s and the 9s, no matter how hard you press, you're not going to be able to feel a rib. You'll feel quite patchy fat behind their shoulders, up over their ribs, along their loin, and all those different areas. These horses, the negative side with them is that it's very easy for these horses to have issues related to laminitis and colic, and some of these horses have other metabolic issues going on. So there's no reason to have them in an 8 and 9, and we would really like to keep most of our horses in a 5, 6, or 7 type range. So something else that we're going to assess and look at our horses as we're watching them, pretty much on a daily basis, is do they have any type of nasal discharge? And there's a lot of different diseases that are related to a nasal discharge. So just seeing a discharge, as you can see in these 2 horses here, doesn't mean that they're sick, and it's really pretty much impossible to determine what they have. Influenza, respiratory rhino, a lot of different infectious kinds of things can cause a nasal discharge. But if they do, take note, watch them very carefully, and see if they start showing any other signs of any other diseases. You might also want to take their temperature to see if they're getting fever, but this is one indicator that those horses are beginning to get sick and have some degree of something infectious going on. There's different issues that you can see related to their eyes. Okay, the horse over here just has a little bit of eczema coming out of their eye, a little discharge coming out of their eye. This could just be from something that he had gotten in his eye that's coming out. However, sometimes if they're getting a type of an influenza, some type of respiratory type thing, just like a person, they might be beginning to get some discharge from their eyes. The horse with a closed squinty eye, if you run into that, then you need to open that eye up and try to look to see. There's a good indicator that this horse might have an eye injury, such as a corneal ulcer or something, that you really need to get the vet out and take care of quite quickly. Kind of notice if they're just showing any general kinds of pain, and this can be from a very mild degree to a very high degree. They might get restless and paw the ground, just showing some signs of discomfort. More painful situations are that they actually lay down and roll. Other things that they just have a change in attitude, and they just can tell that they just don't feel good. We had a mare one time that all she would do, she would squint her eyes and cramp up a little bit, and you can tell she was just having some type of spasms, some type of pain going on. Sometimes they'll just stay away from the herd of horses and be off by themselves. Occasionally it might be that they just begin to sweat, and those might be, some horses are very stoic and can tolerate pain, but they are for some reason, maybe a colic, something is going on. Also, indicators that you have pain is that their heart rate and respiration has gone up. Sometimes they might have an elevated temperature. It doesn't always go along with the type of pain that they might be having. Kind of, these are some horses that are doing some type of pain, showing some type of pain. Both of these horses on the top probably are having some soreness. From the still pictures, I don't know if they're sore in their feet or if they're rocking back and having some abdominal types of pain. So it's difficult in a still picture to know, but anytime horses start to act like this or stand like this, watch them very carefully and see, do they having issues in their abdomen? Are they having foot issues? Maybe they've developed some laminitis, and so be very observant of those horses. Sometimes it might be that it is a colicky type situation. Standing here, the horse on the top kicking at his belly. Not every horse that kicks at his belly is colicking, but if they're showing painful symptoms and things like that, pay attention, and you might get some assistance. Call your veterinarian. The horse on the bottom, they'll lay down and sleep, but if they're down, getting up and down, rolling their eyes, moving around, then that's more of an indicator that they're having some colicky symptoms, some type of painful in their abdomen. Ulcers are more common in horses than what we used to believe or used to know, and sometimes little things you might notice, you're not going to be able to visually diagnose that a horse has ulcers, but some things is just that happy horse is suddenly not very happy. The horse on the bottom, he's pinning his ears. Maybe things are hurting internally. The horse up at the top, the blaze-faced horse, is looking at his sides, rubbing at his sides. So it might just be a little bit of a low-grade colic. Some horses with ulcers simply have a change in behavior. That horse that was very quiet and easy to ride suddenly is not so easy and has some bigger issues with them. And so sometimes those horses, you need to investigate and leave that as one factor of why you might have had a behavior change in these horses. They're not have a strong colic, but they do have some issues that might be going on. So it might be something that you and your veterinarian can investigate. Kind of mentioned a lot of these before, as far as just losing of their appetite, being depressed. If you have a stethoscope, you can listen to their intestinal sounds, because horses should have a bubbly, gurgly sound. And if things are completely quiet, that might be an indication that he's got a colicky issue going on. Diarrhea is another issue. And so there's a lot of different indicators that some horses might have some problems. Sometimes if it is a colic issue, as you see with this horse here, that they've had to come and put a nasal gastric tube down him to go ahead and relieve some of the issues and relieve the colic signs. Strangles is something that if you're around horses long enough that you probably will run into and see, and if they're to the extent of what these pictures are, these horses have pretty significant strangles. So some things to notice if a horse is beginning to get strangles is initially they might just have a discharge out of their nose, some discharge out of their eyes. But classic signs of strangles are that they will begin to get abscesses within some of their various lymph nodes, as you can see on all of these young horses here. And if you begin to see this, number one, you need to isolate your horse from the others and then call your veterinarian and make a plan of action. Different situations, different methods of treatment will be done. Some will lance the abscesses, some will just treat the horses systemically. And so that's a situation where you and your veterinarian will determine for your situation, your horses, what's the best mode of action. But the important thing to note is if they get those snotty noses and discharge from their eyes and begin a fever, that can be a variety of things. But then if they begin to get some swelling in some of these lymph node areas, then that's an indicator that potentially they have contracted strangles. So some things to think about. You're in a situation and you've chosen that maybe you do need to get your veterinarian out, or you're waiting to get a hold of them. So different thoughts that you might think about and look at as you're waiting for the veterinarian to arrive is some horses, if they're colicking, if they have stomach issues, we used to say keep them up and walking, and anymore if they want to lay down and not really thrash around a lot, that's generally thought to be okay. Generally, if your veterinarian is en route, they don't want you to give any pain medications, or consult with them so they can determine between the two of you. Some pain medications can mask some of the signs of what's going on with those horses, so they want to be able to see that they get the best picture. And so it's, to me, it's best if you just consult with your veterinarian and determine what you should be doing. Many times they want you to go ahead and remove them from the hay or the grain. Water is generally fine before they understand and know what the situation is. Again, consultation with your veterinarian is probably your smartest route. If you've run into a horse that has a type of an eye issue, all right, particularly the one up here where the eye is very cloudy and looks like there's kind of some kind of poke or scrape, the first thing you want to do is get that horse out of the sunlight. Okay, get him out of the light, get him into a stall, a darker area, because that's only going to irritate the eye more. What you do not want to do is to go to put some old eye ointment in that horse's eye, because what your veterinarian will do, they will come out and stain the eye and determine how many layers of how deep that corneal ulcer has gone. And so you need to be careful the type of medication. So the main thing that you need to do is get that horse out of the sunlight, and then get assistance out there from a veterinarian to go ahead and determine what the degree of the injury and what to work with. Sometimes you're dealing with things like this. Your horse's leg is stoved up. You may know why, you may not. Generally, you want to get these horses and immobilize them, put them in a stall, tie them up, something like that. If it's an overall laceration, maybe you need to need to run some water on it and some things like that. But also, this is being a good horseman to look and observe and say, oh my gosh, for some reason my horse's knee is swollen, his cannon is swollen, those types of things. In today's world, with our use of our mobile devices and our cell phones, a lot of times a person will take a picture, send that to their veterinarian and say, look, this is what I'm dealing with, and they'll know, is it a dire emergency or he needs to get there sometime, within that day. So a few last things also from until your vet arrives is that you may be, especially if you have a laceration, many times you might send them a picture and they might say, I'll give you a few advice of some things to do. You might not want to put any medication on or different types of things. Kind of just be very careful. You don't want to make the wound worse. Sometimes you want to put a bandage on them if it's bleeding profusely and some of those types of things. And try to keep that horse quiet. And I would actually, if you could, send them a picture and say, this is what we're dealing with. It might be a small cut that they can go ahead and, if you're an experienced person, tell you how to wrap it. It might be, tie the horse up, keep him quiet, I'll be there as soon as I can. So through this, I've tried to give you a variety of things that can help you identify if your horse is in good basic health or if you're dealing with one that is potentially sick. There's a lot of different things that can go on with those horses, so I think first it's important that you have a good working relationship with a veterinarian and that you become knowledgeable so you begin to know what is a true emergency and what is something that you do need to contact them with, but they don't have to run out there to that very moment. So I hope this has given you some good information on how to identify a healthy and sick horse.